We're joined now by Dr. Wayne Wertheim to talk about Botox and fillers. Dr. Wertheim, thanks for coming.
My pleasure.
Botox and fillers. Am I the last guy in America who's not doing Botox?
No, you're not. But just to give you some numbers, in 2005, there were about 3.5 million procedures performed. So now we're well over 4 million procedures. I'd say about 80% of that are women in my practice, and so you're not the last person out there. We still have room and some extra Botox.
I still have time. Huh? Okay. What is Botox? How does it work? Give us some background there.
Botox is a naturally derived protein that we're injecting into muscles that we want to relax. We want to stop the muscle from contracting and therefore stop the line or the wrinkle or the furrow from being created by that muscle contracting. When we inject it in the muscle that is bothering the patient the most, which is most commonly getting the little 11 lines between the eyebrows. We do the forehead furrow lines and very commonly the bothersome crow's feet that everybody gets when they start smiling. When they get over age 40, we all want to get rid of those.
Right. Well, there's been some negative press attention on Botox, or you occasionally hear some things in the media about Botox that's negative. Where do you think that's coming from?
Well, I think that there are a lot of naysayers out there, and you have to separate some of the stories that have been about Botox were not real Botox use. Right. When you're using real Botox, I've been injecting for 5 years. I've never seen a significant complication at all. I think that what you really hear about is bad Botox. You will certainly see somebody on TV or hear a media report in one of these gossip websites about bad Botox. And that usually happens when you drop an eyebrow or you cause them to get what we call a Spock eye, where they get that quizzical look above their eye. And generally, that's poor application of Botox. So if you're going to a qualified physician or injector that's well-trained or well-versed, you're not going to have those side effects occur. It's very safe.
Is it a question maybe of the patient pushing to get too much?
Well, sometimes, but it's really the doctor that has to control that, and a good doctor, a good injector is going to control it. But there are some people that like that frozen look. In my practice, I don't let anybody walk out unless I feel they have that natural, relaxed look. We're not going for that kind of look.
Because if you're saying 4 million procedures, there's a lot of people walking around with Botox, and
that you would never know.
You'd never know. They just look good. They look refreshed.
They
look
Botox.
Relaxed. That's good Botox.
That's good Botox.
And then the occasional wind tunnel look.
That's what not to do.
That's what not to do. Okay. Now, what about fillers? How do those work?
Fillers have become very popular. They work unlike Botox, where we're not controlling muscle. We're actually going to where the skin has broken, what we have what we call etched lines or furrows or depressions that we can actually plump up by injecting a product into the dermis of the skin right below the surface and kind of fill, almost like putting a putty into there to fill those things. These products are generally copies of naturally occurring substances, so there's very little side effect, very little need for skin testing or allergy testing.
Where are those going?
Also in the face, although you can put them anywhere, but the biggest use for them is in the face. And again, in my practice, most common place to put them is in the smile lines, nasolabial folds. And we also use them a lot around different areas of the face where volume is being lost.
It seems to be more popular these days to get the lips plumped. And again, it seems like similar to Botox. I mean, there are women who are really going too far with the lip plumping and getting an unnatural look. But I guess if you just did a little bit, you plump up nicely, give a little volume back. Right. Looks good.
Right. As we age, we tend to lose our lip, and we also have somewhat of an elongation of the upper lip. So what you try to do is give back that natural appearance that they had earlier. Right. Not to give them these sausage lips that people come in and they say, don't make me look like that when I walk out.
Right.
We want them to have a youthful appearance. And generally for that, we use one of the hyaluronic acids, not the calcium-based products. They work longer. They don't have as much problems and complications in the lip, and everybody's very happy with them.
Well, what's new? Where's the trend? Where are the trends headed in film?
Well, what's exciting about this field is that there's always something new and exciting coming along. And in the past year or so, a product called Radiesse got their approval. Radiesse is a calcium-based product rather than the hyaluronic acid-based products. I find that I can get more done with one tube. Patients are coming in, they're purchasing a tube or 2 tubes, whatever they need. And we can do more with one tube because it tends to be a little bit thicker. It tends to go a little bit longer. It lasts a little bit longer. So it's a very exciting product. One of the other exciting things about this is not only are we doing the common things like nasolabial folds, but we're also able to play a little bit because the product has some forgiveness to it, and it also has a lot of volume to it. So when people age, they tend to lose bone. We've been able to cover up these nasty jowls that people get by filling in this area of the chin, hiding them. We can replace temporal loss in here and get away that skeletal look that some of our patients come in with. And some of the most exciting things are we're actually doing some nasal work with it where people have little deformities of the bridge of their nose. We can fix in 5 minutes. And the most fun thing I've been doing lately is doing hands.
Hands?
Yeah, hands. We find that, we can do a lot for the face.
Right.
And we could make you look 10 years younger and get rid of age spots and skin spots and things like that on the face. But when a woman's out, her hands give away her age. So by putting Radius in the hand, I'm able to get rid of a lot of these tendons that show up in the hand because we have fat loss and skin loss in there, thinning of the skin, cover the veins and things like that. And people are amazed that we can actually take 10 years off your hands, and that's becoming a very popular procedure.
Okay, because I was going to say that women's hands are the dead giveaway.
Absolutely.
They can do a lot with the face, but the hands give it away every time. So now you're gonna mask the hands and make it even harder to tell.
That's right.
You're complicating our lives, Doctor. But we appreciate you coming and appreciate the information.
My pleasure. Nice to see you.
Determined to not be the last guy to get on Botox.
There you go.